I can tell you is that this morning, a whole bunch of wonderful contributors to our community have been recognised because the nominations are out for the West Australians, who will then go into the national discussion to be our Australian of the Year for 2018, which of course is announced on the Australia Day or around Australia Day. So there's nominees for West Australia's Australian of the Year. There are also nominees for the Senior Australian of the Year, the Young Australian of the Year, and the Local Hero. There's a whole bunch of them, but I just want to run through a few for the Australian of the Year. There is Dr Tracey Westerman. She's a psychologist, so she has been nominated. Jacqueline Mills is the mother of a son with complex disabilities, and she's been has been nominated on the basis of her advocacy for people with disabilities. The third nominee, someone who you definitely know, Danny Green, for his work in anti-violence advocacy and his work in sports. So Danny Green is a nominee as well. Well done to him. And my next guest, a paediatric oncologist and brain cancer researcher. His name is Dr Nick Gottardo. He joins me on the morning program. Nick, good morning.
Good morning. How are you?
I'm well. Congratulations.
Oh, thank you. Thank you very much. I'm really, really honoured.
How do they notify one of these things, Nick?
Well, I received a email and then a phone call actually a few weeks ago saying that I'd been nominated for the award by some of the families on the ward, which makes it extra special, if you like. And they said, are you willing to, accept, and are you an Australian? And I said, yes, but I probably am a dual citizen, if that counts. And
careful.
And they said, no, that's not a problem.
Good.
And then I got an email a couple of days ago saying it will be confirmed very soon. And then this morning it was announced, which I didn't know it was going to be announced this morning. But yeah, it's all happened really quite quick. And again, I'm still pinching myself, really. I really can't believe it, to be honest.
Yeah, well, as I say, congratulations. Kids' cancer, it's a big and scary thing.
It is, I kind of see this really as it's an honour for me, but I see it as a reflection for all of us that are working to try and defeat these terrible diseases, either as clinicians or as researchers, trying to find better ways of treating these children. It doesn't affect a lot of children, but those that it affects, it completely transforms their lives. Not just for the children, but for the whole family and their friends and everyone around them. What I will say is that the cure rates for the vast majority of children with cancer are very high. But the journey to get that cure rate is very hard. And that's what we want to research, is to find new treatments that really better target the cancer and spare the good normal tissues around.
So tell me about the particular type of brain cancer that you and your team are most interested in.
So, we study all brain cancers, but the particular ones that I have sort of established some expertise in is medulloblastoma, which is the most common malignant brain cancer of childhood. And it's a cancer that comes from some cells at the back of the brain. And we found out recently in the last few years that it's actually composed of a number of different cancers that have got different drivers of them at the genetic level. And what we're now trying to do really is utilize our research in the lab to find treatments that specifically target these different subtypes within this medulloblastoma to more efficiently target the bad cells and try and spare the good cells. And so that's what our research has been focused on heavily, is on medulloblastoma. And the other one that we research heavily as well is ependymoma, which is the third most common brain cancer seen in children. And that one has been very difficult because it doesn't really respond to a lot of our conventional treatments. It relies heavily on radiation and the surgeon to remove the whole tumour.
Right.
And then we're trying to find out if chemotherapy actually adds any extra on the survival, whereas the other one I've mentioned, medulloblastoma, does respond very well to chemotherapy, but also still needs radiation treatment. And it's the radiation that we want to try and do away with if we possibly can, or at least be able to reduce the doses.
Well, it's fascinating work. It's a fine achievement. Congratulations. And I think the fact that you were nominated by the parents on the ward really says it all.
Yeah, that's the thing that, I have to say that it's what gives you goosebumps, to be perfectly honest, because you just don't expect it. And when I read some of the submissions, it brings tears to your eyes that you have that kind of an impact on people. So it really is truly, truly humbling. And like I say, I still can't quite believe it, but, I'm sure I'll get used to the idea soon.
Dr. Nick Gottardo, great to speak with you this morning. Really excited. Well done.
Thank you so much, and thank you for inviting me on the show.
Good on you. Dr. Nick Gottardo, paediatric oncologist, brain cancer researcher and nominee for our state's, what will eventually be our state's nomination for Australian of the Year.